Welcome to my today's talk titled Assessing Women's Knowledge About Breast Density. So there is no conflict of interest. Breast density is the white and bright area of breast on a mammogram. Low density breast mostly comprised of fatty tissue, and it appears dark on a mammogram. High density breast mostly comprised of fibroglandular tissue, and it appears bright on a mammogram. Breast density has no relationship with breast size, and it cannot be determined by touch or feel. The American College of Radiologists categorize breast density into 4 groups. So now, the vital question is, why breast density matters? It matters because it is a common and independent risk factor for breast cancer. Secondly, high breast density can mask tumor on a mammogram. Now, it's a critical question that, do Australian women have adequate knowledge about the breast cancer risk and reduced mammogram sensitivity associated with high breast density? In discussing this sort of problem in the Journal of Clinical Oncology, Selene Vashon, she perfectly commented that there is a historic lack of communication between the medical community and its patients in regard to the limitations of mammography. So we designed our study to address these questions: what currently Australian women know about breast density. We conducted this research in the outpatient department of the Breast Endocrine Surgical Unit of the Queen Elizabeth Hospital. We offered the participant a questionnaire that has been prepared following the questionnaire of Breast Skin Western Australia. After offering this questionnaire to 373 participants, we recorded the response of 300 participants. So our response rate is 80%. In case of baseline characteristics, we can see that 72% of our total participants belong to age group 50 to 74 years. Subsequently, 89% of our total participants speak English at their home, and 61% of our total participants heard the term breast density before. However, only 25% of our total participants, they were told about their breast density by any healthcare professionals. So these 5 questions are the key questions of our questionnaire, where we asked about 2 common misconceptions about breast density and 3 common facts about breast density. We allocated 1 point for each correct answer, and we developed a scale between 0 to 5. And we noticed that 56% of our total participants, they scored 2 and above, and we tagged them as the participants with some knowledge about breast density. Then we see the predictors of some knowledge about breast density, and we identified that age has no significance in some knowledge of breast density. Neither was the socioeconomic index. Besides, number of previous mammograms, language at home, and breast density category, all of these are not significant predictors. However, heard of breast density before and were told about the breast density by any healthcare professionals, both are the significant predictors for some knowledge of breast density. We assessed the responses to the key questions, and we noticed that the women who heard about breast density before, mostly they know that they gave the correct answer of the question about masking effect. Similarly, 68% of the women who heard about breast density before, they know that some women might require the supplementary imaging due to having dense breast. Having heard the breast density before, sometimes the women don't know that it is a risk factor, and we identified that the knowledge is so low in case of women who heard about breast density before, and it is at 28%. However, having heard of this breast density before, sometimes women do believe that there is a chance of increase of misconceptions, like that breast size has a relationship with breast density and it can be determined by the touch or feel. In that case, we can see that 1/3 of the total participants of the group who heard about breast density before, they perfectly know that these are the common misconceptions. Interestingly, that 80% of our total participants, irrespective of the categories, they wanted to know their own breast density. So, to summarize the results, we can say that 80% of women want to know their own breast density. Women who heard of breast density and were told about their own breast density have some knowledge of it, particularly about the masking effect. Subsequently, age and socioeconomic index do not affect breast density knowledge. Alarmingly, most participants did not know that breast density is a common risk factor for breast cancer. Moreover, there are some misconceptions that breast density is related to breast size and how breasts look and feel. As vast majority of our women want to know their own breast density, it can be considered in the role and design of breast cancer screening to ensure it is satisfactory to users. Future breast screening policy must address the ethical issues of clinical management for women with dense breasts, equitable care, patient autonomy, trust, and duty of care. Simultaneously, we are running more two studies. In study 2, we are collecting data to assess the subjective distress of women after breast density notification. And in study 3, we will qualitatively evaluate the surgeon-patient communication about breast density during a telehealth consult. Thank you all.